Breast cancer remains a significant health concern for women worldwide. While it primarily affects older women, there's a worrying trend. Breast cancer rates are increasing among younger women, those under 50. This shift necessitates a closer look at the potential risk factors affecting this demographic. Early diagnosis and treatment are crucial for improving outcomes in breast cancer. When detected early, localized breast cancer is often highly treatable. However, younger women may face unique challenges, including a later stage at diagnosis due to a lower perceived risk. This highlights the importance of understanding the risk factors specific to this age group. Different subtypes of breast cancer exist, and understanding the specific type is critical for determining the best course of treatment and prognosis. Greater awareness and early detection are essential. One particular subtype, estrogen receptor positive (ER-positive) breast cancer, appears to be driving this increase among younger women. ER-positive breast cancers are fueled by the hormone estrogen, which plays a significant role in the development and growth of breast tissue. In ER-positive breast cancer, the cancer cells have receptors that bind to estrogen. When estrogen interacts with these receptors, it can stimulate the cancer cells to grow and multiply, contributing to tumor development and progression. Factors such as early onset of menstruation, late menopause, and hormone replacement therapy can all influence estrogen exposure throughout a woman's life. Understanding these factors and their potential impact on breast cancer risk is crucial for developing effective prevention and treatment strategies. Estrogen exposure is a key aspect of breast cancer research, particularly in younger women. Early puberty, a phenomenon increasingly affecting girls, is thought to be a significant contributor to this rise in ER-positive breast cancer. When girls start menstruating at younger ages, they're exposed to estrogen for a more extended period, potentially increasing their risk of developing ER-positive breast cancer later in life. Puberty marks a significant transition in a girl's life, signifying the onset of reproductive maturity. However, when puberty begins earlier than expected, it raises concerns about the long-term health implications, particularly regarding breast cancer risk. The age at which girls enter puberty has been steadily decreasing over the past few decades. This trend, attributed to various factors including nutrition, environmental exposures, and lifestyle changes, is concerning from a public health perspective. Understanding and addressing the factors driving early puberty is crucial for mitigating the potential long-term health consequences, including breast cancer. Early puberty can be influenced by obesity, genetics, and environmental factors. Obesity is strongly linked to early puberty in girls. Girls with higher BMIs often enter puberty earlier. Fat cells produce estrogen, affecting hormonal balance. Genetics also influence puberty timing. Chemicals in plastics and pesticides may disrupt hormones. Maintaining a healthy weight can reduce early puberty risks. Obesity doesn't just contribute to early puberty. It's also an independent risk factor for breast cancer, especially in postmenopausal women. Fat cells produce estrogen, and after menopause, when the ovaries stop producing estrogen, fat cells become the primary source of this hormone. This increased estrogen production in obese women can fuel the growth of ER-positive breast cancer cells. In addition to increased estrogen production, obesity is also associated with chronic inflammation, insulin resistance, and alterations in other hormones, all of which can contribute to cancer development and progression. Inflammation, a natural response to injury or infection, can promote cancer cell growth and survival when it becomes chronic. Obese individuals tend to have higher levels of chronic inflammation, creating a more favorable environment for cancer cells to thrive. Addressing obesity and its associated metabolic disturbances is crucial for reducing breast cancer risk. Insulin resistance, a condition in which the body's cells become less responsive to insulin, is another hallmark of obesity. Hormonal birth control, such as the pill, has revolutionized family planning for women. However, these contraceptives can slightly increase the risk of breast cancer. The hormones, primarily estrogen and progestin, can influence breast tissue. Discuss the potential risks and benefits with a healthcare provider. Consider factors like family history and age when making decisions. Combination pills have a slightly higher risk than progestin-only pills. The decision should be made in consultation with a healthcare provider. While estrogen plays a significant role in breast cancer development, other factors are also being investigated. Exposure to certain environmental toxins, such as pesticides and chemicals found in plastics, is a growing concern. These endocrine-disrupting chemicals can mimic estrogen in the body, potentially contributing to the development of ER-positive breast cancers. Endocrine disruptors are chemicals that can interfere with the body's endocrine system, which regulates hormone production and signaling. These chemicals are found in various everyday products, including plastics, personal care products, and even some food packaging. The concern with endocrine disruptors is their potential to mimic or block the action of natural hormones, such as estrogen. Minimizing exposure to these chemicals by choosing BPA-free products, opting for organic foods whenever possible, and being mindful of chemical exposures in the home and workplace are prudent steps individuals can take to reduce their potential risk. More research is needed to fully understand the impact of environmental toxins on breast cancer risk. Delaying motherhood is also associated with a slightly higher risk of developing breast cancer. While pregnancy and breastfeeding have protective effects against breast cancer in the long term, delaying these events can increase the window of susceptibility during which breast cells are exposed to estrogen without the protective benefits of pregnancy hormones. Pregnancy hormones, particularly progesterone, are believed to play a role in the protective effect against breast cancer. During pregnancy, progesterone levels surge, promoting the differentiation and maturation of breast cells. Breastfeeding also offers protective benefits against breast cancer. It further promotes breast cell differentiation and reduces the number of menstrual cycles a woman experiences throughout her lifetime, thereby reducing estrogen exposure. The decision of when to start a family is deeply personal and influenced by various social, economic, and individual factors. Understanding the potential impact of delayed motherhood on breast cancer risk can empower women to make informed decisions about their reproductive health. Despite extensive research, the exact causes of breast cancer in younger women remain elusive. More research is urgently needed to determine the complex interplay of factors contributing to this alarming trend. Understanding these factors is crucial for developing effective prevention and treatment strategies tailored to this demographic. The rise in breast cancer among younger women underscores the need for more targeted research efforts. Further research is needed to explore the role of genetic predispositions, environmental exposures, lifestyle factors, and their interactions in driving breast cancer development in this population. Investigating the potential long-term effects of early puberty, obesity, and hormonal exposures is crucial for developing effective prevention strategies. Funding for breast cancer research is essential for advancing our understanding of the disease and developing innovative approaches to prevention, early detection, and treatment. Supporting research initiatives and advocating for increased funding are crucial steps in the fight against breast cancer. Developing accurate risk predictive models for younger women is paramount. These models, incorporating factors like early puberty, obesity, family history, and lifestyle choices, can help identify women at higher risk. This allows for personalized screening and prevention strategies, potentially leading to earlier detection and better outcomes. Traditional breast cancer risk models primarily focus on factors relevant to older women, often failing to adequately assess risk in younger women. Developing risk models specifically tailored to younger women is crucial for improving risk stratification and guiding preventive measures. While the rising breast cancer rates in younger women are concerning, knowledge is power. Understanding the risk factors, recognizing the early warning signs, and adopting healthy lifestyle choices can significantly empower women to take charge of their breast health. Early detection remains the cornerstone of successful breast cancer treatment. Recognizing the early warning signs, such as changes in breast size or shape, skin dimpling, nipple discharge, or any unusual breast pain, and reporting them to a healthcare provider promptly is crucial. Adopting a healthy lifestyle can significantly reduce the risk of breast cancer. Maintaining a healthy weight through regular exercise and a balanced diet, limiting alcohol consumption, and avoiding smoking are essential steps in reducing overall cancer risk. Regular breast self-exams and clinical breast exams are crucial components of early detection. This, coupled with regular screenings as recommended by a healthcare provider, can significantly improve